Hi, welcome to another edition of Orthopod. My name is Mo Bendari. I'm the editor-in-chief of Ortho Evidence, and I get the pleasure of interviewing some colleagues and friends from Los Angeles. Let me begin first, if I could, by introducing Dr. Milton Little, Orthopedic Trauma Fellowship Director there at Cedars-Sinai Orthopedic Center. He's also an assistant professor and an orthopedic trauma surgeon. Dr. Carol Lynn is an orthopedic trauma adult reconstructive surgeon, geriatric fracture program director, and associate program director, also at the Cedars-Sinai Orthopedic Center. Welcome both, and thank you so much for spending a bit of time with us.
No problem. Thank you for having us.
Thank you so much for inviting us.
No problem. So let me give, if I could, just a brief update, and I'm going to ask you just for your initial maybe thoughts on the opening stats. So we are now months into COVID-19. And unfortunately, while many around the world I think have felt that there's been so much information on this topic, it continues. And I think it's a worthy discussion to continue to have. We're about 12,200,000 cases worldwide, just over 553,000 deaths worldwide. In the United States, I believe, is just over 3 million of those cases worldwide, with California, I believe, being the second, most affected of the states, second to only New York City, with about 296,000 cases. I think that's a relative representation of the current situation. I wonder, Milt, if you could just maybe speak, and then I'll have you maybe chime in as well, Carol, about what's it like right now in Los Angeles, particularly as you continue to see cases increasing?
I think it's, I think at this point now, and I think Carol can speak to this a little bit more, in the county system, I think that's the system where it's being overwhelmed. I think that our first initial response to kind of the corona crisis and coronavirus was extremely forward, at least for the United States and the way the rest of the country responded to things. I think Gavin Newsom's decision to implement, masks early, implement a stay-at-home order, all of that was pretty successful and also was pretty well incorporated, at least in Los Angeles, in many areas. I think there were obviously areas where we could have been stronger in terms of where people were going outside and things like that. But, our early response to it actually was pretty well controlled. I think what has happened now with our reopening, is something that we did not necessarily anticipate. And there are a lot of areas that are becoming overwhelmed with their ability to handle the cases. For us, Carol and myself, I think, our hospital at this point has been running kind of full bore since May 24th, with elective cases. And, from a trauma standpoint, things did not slow down. It actually picked up, especially in late May, early June. And we actually at our hospital have a coronavirus census tracker, which, I check very regularly, and that tracker has been pretty stable actually since, even after our reopening. So we're not seeing, I don't think we're seeing the huge wave or the overwhelming component to it in our hospital yet, but I think our ICUs are starting to see a little bit more increases at this time.
So right now, before you jump in, before Carol jumps in, how many cases do you have active cases right now at Cedars-Sinai?
Yeah, we have about 80 active and, 80 active and presumed or in the process of being tested cases. And I think the majority of those are actually active cases.
Got it. So from your perspective, Carol, how does this resonate for you?
I think this is a real lesson in social psychology in a lot of ways. We all saw New York, and we were terrified that was going to happen in LA. I think we learned a lot of lessons from that. You know, LA has a very different urban environment than New York does. Not as many people take public transportation. And we also, I agree with Milton on this. I think our civic leadership was pretty appropriately aggressive in shutting down the economy to preserve our healthcare infrastructure. But I think for that reason, we never saw the devastating surge that New York had. And there was a huge economic impact. I mean, within, I think, a few days, we had shut down all elective surgeries at Cedars, which, you know, runs, I don't know how many hundreds of elective surgeries a day, and really only transplant, cardiac, and trauma and tumor were allowed to continue. And in tumors, even the sort of exceptionally aggressive critical tumor cases. And our elective partners, you know, in our total joint sports world, they were just, for 6 weeks, they had no volume. And there was definitely pressure to start reopening things because the entire state was shut down and we had a $20 billion hole in the economy. And whereas before we had a $20 billion surplus. And I think because of that, when we started reopening, people just, and you know, they weren't the social distancing guidelines and masks were not heavily enforced. There are certain counties in California actively rebelled against limitations in opening because they were sort of desperate to get things restarted. And now we are seeing the backlash from that, especially in the more underserved communities, which our county system supports. So now they have had to stop their elective surgeries now because they're running out of volume of, they're running out of places to put patients in the hospital. The ICUs are getting full. And they, last tracking, they're a little bit worried about the PPE supply because it's not, they have them now, but they're forecasting they have about anywhere from a 10-day to 12-day supply at any one point of time, as opposed to a more comfortable 30-day supply because of the way the supply chains work.
Hey, Carol.
Yeah.
Just one thing. I mean, one of the things that I think both of us thought was interesting, I think Cedars had one of the highest, you know, had the highest COVID census in Los Angeles in the for the whole first
our hospital wave. Yeah, we've treated the highest number of COVID patients in the city and county of Los Angeles.
Wow. So I don't understand why at this point now that switch had, like, why we're not seeing the same rapid increase that the counties are seeing. Do you you know?
I don't have this is my estimate for that, and it has to do with our patient populations, which are different. So the county system, which is the safety net system, and it's comprised of 4 hospitals, 2 major ones, which is USC LA County, and then down at Harbor UCLA, which is, again, those 2 hospitals serve primarily uninsured, underfunded patients. And those are the patients that are affected the most and in which group the virus is spreading the most rapidly now that the economy has opened up more. And so that group does not have the luxury of being able to socially distance at home or do, you know, internet meetings. You know, they have to be in person. And again, if social distancing and masking is not strictly enforced at their places of work, then they're particularly vulnerable. Our hospital is we serve a bit more affluent population. We have a smaller proportion of higher risk, underfunded, uninsured patients. And I also think that our hospital leadership did a very good job at the beginning of keeping resources in mind, personnel in mind, and over preparing, which is what you would want to do in a pandemic. Even so, they're starting to think about redeploying physicians into different specialties to help support the medical and ICU units. We're not quite there yet, but they're planning ahead for that because of what we're seeing happen in the county system.
Can I ask you both? So this is exactly what's happening in Canada, where there's this feeling of there was, it's never, there's always perception saying, well, maybe we were over concerned and we kept everything down, which is good, right? Because you have a very strong first response, and we never saw really the surge that we had feared in many other countries and we had seen. And then we're about now in this second phase, and third phase of reopening is a full reopening. What was it like? So like when you said there was a robust response in what you're calling the first wave, and I guess my question is it truly the end of the wave that happened, or was it really a second peak? So when you say that you had a good response, what kind of, like, what were you down to in terms of new cases, let's say in Los Angeles, and now kind of what's happened in this surge? Like what's sort of a guesstimate of what's been going on in terms of what did you call a success and what's happened subsequent to that?
I think that, I mean, we can speak of what our personal experience was on the ground, which was our hospital ICUs were no longer full. For a period of time, we had an entire ICU plus overflow units dedicated entirely to,
wow.
Yeah, all three ICUs plus an overflow unit were created specifically for COVID.
Right.
And, you know, stopping all elective surgeries, all the spine and transplant and everything was also heavily reduced. And for us, our metric of are we past that is our ability to restart these elective surgeries, because to us, it indicates our supplies are okay. We won't have to convert all of the OR vents to ICU vents, which was on the plan, actually. You know, our ortho residents are not being redeployed to OB or ICU, which has actually happened for a little while. And, you know, what does, though, serve as a marker for concern that this is an ongoing problem is that our clinic volume is still heavily rationed. So our clinic volume is, in terms of getting new elective cases, is still limited to about 50 to 60% of our typical capacity. So and also our normal elective surgery schedule is not quite normal. I would say that it's close. It's probably 70 to 80%. But in terms of our day-to-day block time and booking schedule, there's still a filter where they're triaging a little bit, you know. So it's not normal. And I agree with you, Mo. It was never, a wave was never over. We plateaued and we flattened the curve.
Yeah.
And the curve shot up.
So here's the thing, right? So this is what's happening here. I'll give you some rough numbers, and you can probably extrapolate. But Ontario population around 15 million is down to just under 200 new cases identified per day. Now you can argue, are we testing enough, and whatever that number may be. But with reasonable testing, the numbers are around 200. So, and you know, the reopening is imminent for us. Even though there's concern, there's general reopening that is imminent. That's going to be happening, and I wonder, from your experience, let's say, you know, California being roughly about 3 times the size, or at least double, were you at that, like, were you under 1,000 cases roughly at the time you were starting to say, okay, we're over the worst part of this? Or was it really down to, because like, we will not be down to 0. Like,
oh no,
like in terms of WHO, WHO says the wave is done when it's gone. And then it comes back in a second, you know, and we can talk about the reality of what's going to happen in 3 months from now. But it feels like us that we're in this period where everyone's feeling a sense of confidence that it's going to be okay. And then there's this, and that's what's happening. We're seeing it around the world, where once you truly reopen, are we all destined to have your experience? And I guess, do you feel your experience in LA is going to be unique, or are we all at risk of the same issue?
I think I don't know if part of it was too much too fast.
Right.
You know, and this is just based on, you know, for June, the hospital itself, the surgical volume for the orthopedic service was 18% above what we were a year ago.
This is for the trauma service.
Yeah. Well, no, not only for the trauma service. This is for,
oh, really?
Yeah. Right. So there was a huge component of, we're open, let's go. Right. And so there wasn't really any I mean, it was, you know, trauma was continuing. Electives cases, everybody had a backlog of, you know, 3 months worth of cases. And so there were always places to put cases. We didn't open as many rooms, but we set up systems so that things were operating more efficiently. Right. So we were running, you know, 10 or 15%, sometimes even 20% less rooms, but we had, you know, teams available to spin off, to actually expedite turnovers, teams available to expedite, you know, opening rooms and things like that. And so with that, we were able to increase our volume. And so the same thing I think happened with, eating outside. And, for us, when they opened up restaurants, it wasn't outside restaurants only. It was outside restaurants, inside restaurants.
Okay.
There was social distancing, but the whole way. And there were other things that were opening that did not have, I think a few movie theaters opened up without mask requirements. I still haven't eaten in a restaurant, but I have lots of friends who were in restaurants, on the day that they allowed us to open. And, I think that was a large part of it. A large part of it was, we're open, let's be open, let's go out, let's be active. And then the other part of it was, once you added, the killing of George Floyd, the killing of Breonna Taylor, the protests, and I think for a subset of people, it was like, you're having giant protests. Why do I need to social distance anymore? You know what I mean? I think the protests were necessary and critical, but I think in response to the protests, people were having birthday parties and barbecues and other things, and saying, this is my way, because you can protest that, I should be able to go wherever I want to go and not wear a mask. Even in the early stages of this wave, there were counties, like Carol said, there were counties that had no mask requirements. I went up to, Ventura County, or I went down to Orange County, and people weren't wearing masks in the beginning. And so, I think once people were allowed to be open, they went full. I don't know if our waves were necessarily set right.
Right.
But, and I think, again, it's almost like like everything in trauma, it's like two demographic peaks of what's going on right now, right? So older patients in the 60 and over, they take this very, very seriously, and that's because the death rate was up to 80% in some places if you were intubated, right? Yeah. And so we still have older patients who, now that their total joints or elective procedures are okayed, they don't want to do them. They don't want to be in the hospital or anywhere near a hospital. They don't even want to come to clinic. And I think that's really correlating with what we're seeing in the new cases now, which is young people, because their direct impact from the virus is relatively minor. If we definitely have some tragic, well-publicized deaths and prolonged hospitalizations in young people at our hospital and in the hospitals in the area, but that's such a rare occurrence, relatively speaking. And the rate of asymptomatic carriers is so high in young people that, we relaxed our social restrictions as a state on Memorial Day, and immediately people were out. I mean, it was probably the worst. The beaches were open. Nobody's going to be sitting 6 feet apart at the beach. People are having barbecues and parties, and then predictably, 2-3 weeks later, we saw a spike.
So it happened quick then. So in other words, like as soon as they went to the full,
it's all or nothing.
Yeah, we're contemplating. I'm sure many either cities or states or provinces are contemplating exactly what happened, which is full reopening. We think we've gotten it down to a flattened rate, or down to a few hundred cases. Let's open and let the economy thrive. How quickly from that full reopening to what's happened now? So I presume maybe you could sort of give me some insight as to what is the current situation in terms of distancing. Have things have been shut down again, or are things still completely open, or what's happened? What was the response to all this, and how quickly did it?
So the response, I would say, is probably about a week behind. So we opened up everything, and I think states like Texas and Arizona are a really clear example. So Arizona was projected to run out of ICU beds very early, but they had very strict guidelines, and they kind of flattened, and every day the estimate came down and down and down until it looked like, oh wow, the healthcare system is okay. And I think people didn't understand also that the flattening the curve is not going to change the number of infections. It just changes the pace so that the hospitals don't get overrun and you don't have people dying in the hallway. And so then you know, within a couple of weeks of, okay, the curve is flattened, let's just you know, open the economy, and people are in the airports with no masks like normal. And then 2 or 3 weeks later, they are really running out of ICU beds now in Arizona, especially in the Navajo reservation or the underserved areas. And we saw that to a smaller degree in California. I think our hospital capacity and healthcare infrastructure is overall, if we look at everything, all the different hospitals, is still quite robust. And in these counties where they never really took the mandate that seriously and sort of they made the masking and social distancing like a recommendation. That if you opened up a business and you weren't wearing a mask, no one was going to find you. No one was finding you, or I mean, it was just it was a toothless expectation. I think what we saw was basically within 2 or 3 weeks, cases going up. And then about a week after that, hospitalizations going up. And then shutting down elective cases again.
Okay.
And sort of in parallel with that, it was, you know, reopening Memorial Day. Okay, everybody just sort of went on a free-for-all. And then by July 4th, so you basically
before July 4th.
Even before July 4th, but hard stop at July 4th. Beaches are closed, parks are closed. You know, within 3 to 4 weeks of that Memorial Day opening, it was, okay, wait, restaurants can only do outdoor dining now. Indoor dining is shut down. So I think that the leadership was trying to find the middle ground, because you can't shut down completely. It would be very difficult to do that. And I think that would probably be the timeline if that's what you're talking about in Canada.
Right. And right now, so at present, right now, beaches are closed.
So beaches are closed, except I think parks are closed. Some of the parks are open. Outdoor restaurants, you can do outdoor restaurants. You can't do indoor restaurants. You can't do bars.
The gyms are still open, but most gyms have very strict social distancing. And the other thing to realize is that it's almost like a balkanized situation. Like it's a county by county, sometimes even city by city. It's you know, no matter what the governor says, you have some counties where they don't see much and their economy is suffering, and they're like, no, we refuse. Or the police, I mean, it's this very, you know, not uniform application, and that is definitely contributing to the rise in cases, because you've got differential application of these guidelines.
Got it. So when you look now to the next months, what do you, I mean, this is actually really an unfair question broadly, because the truth is, I don't think we can predict what's going to happen next week. But here I am asking you, based on what you've just gone through and what I guess the city has gone through and what you've learned, because you've opened fully. Well, you had great success, opened fully, and had to take a step back. So what do you see now going forward?
And I would say, I don't think we opened fully. I think we were going through the phases. I don't think we ever got to the full open phase. Right?
But it looked pretty close though, right?
It was close. It was very close.
It looked like it. It was about there.
I mean, it might as well. I mean, it might as well have been, but it was like, I think we were at the third phase of 4.
Okay, got it. Like that. And we're about to enter what I think would be what you're calling the third phase. So, you know, there's a lot of interest in, you know, what to do.
You know, initially when this was going on, I was hopeful that the complete restrictions would last for the entirety of, you know, would last throughout all of May. And, you know, nothing would really start until the beginning of June. And, you know, at this point now, and then I was hopeful that life would start to get back to normal in September. At this point now, I don't think life will be back to normal until January of 2021. And even then, you know, I'm not completely optimistic. You know, like everyone said, nothing is going to change until you have a vaccine that people trust. And, you know, I anticipate that we may have to shut down elective cases again at some point. I just don't know when.
Got it.
Yeah, I agree. I think we're going to see this sort of up down, relax a little bit, cases slightly go up until we find the right middle ground of new cases, but not new hospitalizations. And again, the concern is the healthcare infrastructure as a priority. And unless you can do something like New Zealand did, where they literally shut down intensively and had 0 cases, and then still continue to have extreme quarantining procedures at the border.
Yep.
I don't think we can confidently let things open up. And I do think, though, if you look at other economies like Japan and in other countries in Asia, where people are very, they're very comfortable with wearing masks in public already. Mm-hmm. And it does seem to be that the biggest vector or area for transmission is indoor, prolonged, no mask. Mm-hmm. And I think if people could wear masks and be comfortable with that that's probably going to be our way of life, I would assume.
Right.
I'm anticipating for a year, if not more.
Yeah, I'm with you. And I can tell you, there was so much celebration around what New Zealand had done. And then literally 2 weeks later, they're back up in cases, right? And that's the problem, right? So nobody wants to celebrate because you just have this little bit of concern that it's not over. And as long as, for us as, your neighbors to the north, when we see a neighbor, and I use the analogy, you can't have a nice function in your backyard when your neighbor's house is burning down. No matter what happens, I'm fine, I can be normal, but something is happening over there. And we want to see America completely, back to full function before I think we will see North Americans feel a sense of, just travel again, wherever that may be. But I'm with both of you. I don't see myself on a plane in 2020.
No.
We just don't see it. We are going to be doing what we're doing now and trying to learn. But I can't thank you both enough. This has been extremely, extremely helpful. And you clearly both have a very thoughtful approach. So you've been thinking very carefully, I'm sure, about this. It's hard not to when you're amidst it.
It's your thing. You're thinking about it constantly. And Carol, I think the one thing the hospital is looking at, I think the reason that things will continue at this clip for us is that our number of cases have been steady, right? I think we're not even at 8, we're at 73 today, right? And since the things started going down, we got down to, I think at minimum, we're at 50 something maybe.
Mm-hmm. Right.
I think our max, we've got a capacity for 850 patients up to 1,100 if we have overflow and we use every little space. And I think at our maximum number, it was about 130 patients, so 10%.
I think we got to 150. We got to
150 was our highest.
Yeah. Right.
But then since then, we've been 60 to 80, but I have no doubt if we start hitting 100 cases active in the hospital again, they're going to start, they'll start shutting us down again. So we have no idea if and when that will happen.
Nope. That's the point. And I have a feeling that we'll be on the, I guess we'll be on a video chat again in a few months, and I look forward to at some point getting to LA to visit. But I might even make a guesstimate of what that's going to like, or have you up to Canada and visit us. Maybe that's better. I don't know.
Exactly.
But our borders aren't going to be open anytime soon.
No, keep them close.
No.
Keep them close. I think that's it.
I think that's the other thing that Carol was mentioning, right? As long as there are different counties doing different things, this is not going to stop. This is like different counties, different states. And, as long as that's the case, that, until there's national rules for what we can do, what we're allowed to do, what the phases are for opening, what mask rules there are, it's not going to go away.
You're absolutely right. We've seen surges happen as soon as they've opened and so the concept of migration, forget about immigration, just migration, one group of people moving to another place. There's been modeling studies in the Lancet, take it to lead if you believe in the modeling studies, but 4 individuals with active infection can lead to a major outbreak in some place. If they end up in one place, it can be and then the 60% chance of a major outbreak in another area. It doesn't take you don't need hundreds, you need a few people to do it. And that is what makes this very, very difficult. for all of us. And so everyone's saying, just stay put, you know, where you are. If we know where you are, find out who you've been in touch with, and all of you just stay put, right? Until we can get over this. But I don't know. I can't thank you both enough. I've taken up enough of your morning, and
thank you for having us.
No, absolutely. And we'll definitely be in touch, and wishing you both the best as you work your way through this. And we're going to learn a lot from this, and we'll do our best, hopefully, to take your sage advice and hopefully convince some of the individuals in our healthcare system to be acting carefully and appropriately, because there is a risk of that second peak. I think that's a real risk.
Definitely.
Thank you both.